Reflux refers to the movement of material from the stomach up into the esophagus through a muscle that connects the two. That muscle is called the lower esophageal sphincter. Usually it remains tight, but when it becomes loose, the stomach contents will migrate back upwards. Usually that is acid contents moving up, but sometimes it can be non-acid, including food or including air from time to time. It's usually occurring because of an incompetence or ineffectual contraction of that sphincter. But some individuals will have a delay in emptying of the stomach, so food sits around in the stomach for longer and as a consequence is more likely to come back up. You may come across the term hiatus hernia, which refers to the stomach sitting slightly higher up in the chest wall or in the chest cavity, and that then increases the likelihood of reflux, again through an interference of functioning of the sphincter muscle. Some individuals have what is referred to as a hiatus hernia, which refers to movement of the stomach up into the chest area, and that also renders the sphincter muscle incompetent or ineffective, hence predisposing to reflux. People who complain of acid reflux will suffer a variety of symptoms. In the short term, they may complain of a burning sensation behind their breastbone. They may complain of a belching feeling, bringing up air or regurgitation of food. They may have an acidic taste in the mouth. They may experience a feeling of sickness or nausea. They can also experience what we call atypical symptoms or unusual symptoms, such as a cough, particularly at night when acid is coming back up and then spills up into the lung and causes spasm or coughing. If symptoms have gone on for a while, it may have resulted in a complication of acid reflux, and the classic one is a formation of a stricture or narrowing of the lower end of the esophagus, in which case they may complain of difficulty swallowing food, it may get stuck, or they may complain of pain when they swallow. Acid reflux is treated in a variety of different ways, usually split up into three. There are lifestyle measures that individuals can engage in themselves, such as adjusting their diet and eating patterns, avoiding eating late at night, avoiding large meals, chewing their food properly and slowly, washing it down. There are certain foods that might precipitate symptoms, so things like caffeine and alcohol, fatty foods, sometimes spicy foods. These are all known to precipitate symptoms. Drinking carbonated or fizzy drinks can also aggravate symptoms. So there's a whole range of lifestyle measures. The second tier usually is then the introduction of medication, usually to reduce the amount of acid being produced in the stomach. The classic drugs in that category include drugs like omeprazole, which are referred to as proton pump inhibitors. These can be combined with other drugs that stimulate the contraction of the stomach to empty, so the combination of the two reduces the amount of acid available to reflux back up. When all those measures have failed, then surgery is often an option in a minority of patients, probably about 5 or 10% at most. Recently there have been some advances in surgical treatments in particular in the management of reflux problems. The classic treatment over the years has been what is referred to as a Nissen fundoplication, and that involves wrapping the upper part of the stomach in an axis, usually around 270 degrees, which then enhances the sphincter muscle and thus reduces the amount of acid reflux coming back up. But more recently, we've seen the emergence of a device called a LINX device, which is a magnet which is attached around the outer part of the esophagus, and it's done surgically under a keyhole technique under full anaesthetic, done by a surgeon. And what it basically does is attach itself as a magnet that is made to measure on the outside of the esophagus, so that when food goes down through the esophagus, it pushes open the magnet and goes into the stomach. And then when the food is resting in the stomach, the magnet opposes itself and acts as a sphincter. And that device is called a LINX device. It's becoming increasingly obvious that that is beneficial when selected in the right individual.